Hey everyone, it's Dr. Bryce Gates here with Custom Dental. So, do you ever have sensitivity whenever you're brushing? Most of the time, whenever patients are having sensitivity, it's right along the gum line. And one of the very common things that creates this is actually may not be what you suspect. It comes from clenching. So when we clench our teeth together really hard, we're putting a lot of force down on those teeth, and there's moments of what we call lateral flexation from side to side. Because our cusps of our teeth, the hills and valleys, are like this, when we clench down, sometimes it puts pressure in a side-to-side motion. Now that's different from grinding, it's just clenching, but it puts enough force on something that can actually cause damage. So think of it like this. If you have a coat hanger, plastic or metal, and you start bending it back and forth, back and forth, back and forth, back and forth, eventually you look at that, you can break it in two. If you look at it before it breaks, you'll see this little notching, like a V, like a beaver eating into the side. The same thing happens on your teeth. If you are to look at an area where you might have sensitivity, you might notice that my fingernail kind of fits into this little groove at the gum line. That's the fatigue, that's the notching. It's called an abfraction lesion is what it's called in the dental world. However, what that does is it causes the gum to recede as well. So a lot of times, if you're having sensitivity of the gum line, you see that lesion that's like a V shape called an abfraction lesion. It's actually due from over-clenching, over-stressing on your teeth. We oftentimes carry stress in our back, our shoulders, our neck, and also in our masseters, which are our jaw muscles. That's another thing that you can notice with if you're clenching a lot, you're going to be probably tight all throughout here, all throughout your shoulders. And one of the best treatments for this, rather than allowing for that to do damage to your teeth, which is irreversible, it's kind of like, what can you do to buffer that? Well, if you had a knee or an ankle sprain, you might wear a brace to give support. For your teeth, we use a night guard, and it's a much less expensive route than letting the damage take its toll over the time and having to have crowns or fillings and stuff like that done. Instead, you can just get a guard that you wear at night, and that will help. I can go into more detail about how that works on another video. Bye.